Okay, we're going to do our moist to dry dressing change. So first off, what we're going to need to do is check the doctor's orders for confirmation for the procedure. Once we do that, I'm going to gather up our supplies. So gather up all our supplies. We're going to check the integrity of the packages, expiration dates on them. And for this procedure, I have my gauze, tape, my cotton swabs, saline, measuring instruments, forceps, and sterile gloves. So we're going to be doing removal, assessment, measurement, and then applying the new bandages. And then from there, we're going to come in, introduce ourselves, provide patient privacy. We're going to get confirmed patient, first and last name, date of birth, any allergies. We're going to explain the patient to the procedure to the patient. So we're just going to let them know that we're going to be removing the old soiled bandage, assessing their wound, cleaning it, and then applying a fresh clean bandage. Okay. We don't have any medications, so we don't have any have to do any of the rites or anything. So that's it for the what I have to do beforehand. So what I'm going to do now is we're going to assess for pain. So want to assess for pain. If they do have any pain, we're going to medicate 30 to 45 minutes beforehand, so that way it is less painful and it's more comfortable for them during the procedure. So initially, after we do that, we medicated the patient. I'm going to start with the removal, so I'm going to sanitize, hand sanitize, and then put clean gloves on. Okay, so once we have our clean gloves on, we're going to go ahead with the removal. So what we want to do for the removal is we're going to peel up our bandages, or the edges of the tape, making sure we hold down the uninjured skin. Oops, it's not really taped down very well, but we want to hold down the uninjured skin while we peel up all the edges. So again, they're not really on there well, but we would go one by one, making sure we go parallel to the skin while holding down the skin around the wound, so we're not pulling it and causing any damage to the skin. Once we have all the tape lifted up, we're going to remove each layer one by one. So my first layer would be the ABD, and we're going to remove it one by one and place it into a bio bag that's going to be set up next to us. As we're removing it, we want to make sure we keep the inside of the bandage away from the patient's view, and we're going to be checking for any exudate, characteristics of it, amount, so we're going to be charting all that later. So we're going to do that for each bandage. So remove that, we checked it, dispose of it, and we're going to go layer by layer, doing the same thing for each one. So we check this one off to the side, and then check this one off to the side, and then we have our packing that's in there. It's going to be our last removal. So again, checking for everything, smells, colored, amount, all that stuff. Once we got everything removed, I'm going to go ahead and take these gloves off, dispose of these, and then I'm going to sanitize. After I sanitize, I'm going to put new gloves on and move to my assessment stage. So my assessment stage, so new gloves on, ran out of gloves here, so new gloves on. We're going to assess for RETA, so redness, edema, ecchymosis, drainage, and approximation. We're also going to note the stage, so this is going to be inflammation stage, and then we're going to get our measuring tools, which is going to be this right here, so we can measure the wound. And then we also have our cotton swab, so we can measure depth and also check for any tunneling. So you always want to measure length from the longest part of the wound. So we're going to measure in centimeters. So this looks to be approximately 13 centimeters in length. And then the widest part is approximately about 3.5 centimeters. So it's going to be 13 by 3.5. And then for depth, what we're going to do is we're going to go to the deepest part of the wound. We're going to use our fingers to mark where the top of the wound is, and then we're going to use our measuring stick paper again. So this looks to be about 2.5, so 2.5 inches deep. So 13 by 3, I think I said it was, and 2.5 inches deep. So that's all our measuring. That's it for our assessment stage. And then I would remove my gloves, sanitize, and then after the scratch that, before I remove my gloves, sorry, we would actually do the cleaning portion. So scratch that, didn't remove the gloves. We're going to do the cleaning portion now after our assessment and measurements. So I'm going to get my gauze, and then I'm going to open my gauze, saline or whatever the MD ordered to clean with. And for this, I'm going to pour over my gauze. And then what we're going to do here is we're going to clean from least to most contaminated. So let me just set this up a little better. We're going to clean in, dispose. And then I'm going to go ahead and grab a new one. So I would grab a new one. Same thing, fold it up, and then over right here, dispose of it, grab a new one, and then I'm going to do the edges, get rid of that, grab a new one, and then I'm going to get the other edge. Okay, so that's it for our cleaning part. And then I'm going to go ahead and set up for the next part. So I would remove my gloves now, sanitize, and then I'm going to prepare for the new packing and the rebandaging or the new bandaging stage. So what I would do is I would get my supplies. So I'm going to need another thing of gauze and then also dry gauze. So I have my gauze, dry gauze, and I'm going to open both of them, maintaining sterility because the outside is sterile. Or sorry, the outside is not sterile, but the inside is sterile. So I would set both of them up. And then I would get my dry one too. Set this one up also. Sorry, it's kind of hard to see. So I would have them both. Let me just set that to the side. I would have them both set up, ready to go, maintaining the sterility. So those are both ready to go. And then from there, that's where I would resanitize, or I would grab my sterile gloves, and then I'm just going to set this out of the way for 1 sec. Grab my sterile gloves, my supplies are set up, and then I'm going to go ahead and put my sterile gloves on. And we want to, as we're doing this, again, we want to maintain sterility, so our 1-inch border along the outside. Sorry, it's a little tight right here. So maintain sterility, and then we're going to get our sterile gloves on. Okay, and then make sure we keep our hands above our waist. And then I'm going to go on the inside here. And then get my other glove on. And then again, this hand is sterile, so I can fix it from here. Just making sure I'm not touching the contaminating inside. So I have my sterile gloves on now. Again, I'm just gonna reset everything back up, but I would already be right here, my sterile filled. I'm just gonna get this out of the way because it's a little tight. And put my wound back. So still maintaining sterility, facing the patient. I already have my gauze set up, pre-moistened for the packing, and my dry gauze set up. So I would get a piece of gauze and wring it out, and then I would open it up and lay it flat across the wound, and then I would proceed to pack the wound. And for this part, ideally I would have also grabbed a sterile forceps to assist in packing the wound. But when we do pack it, we want to make sure we're covering all the areas inside the wound. We don't want to pack too tight, and we also don't want the packing to come above the lip. So ideally I probably would have cut this one also to make it fit a little bit better, but I failed to do that, so that's what I would have did. But yeah, make sure it's all packed. So once we have it packed, then we can grab our dry gauze, and we're going to place our dry gauze over the top. Dry gauze over the top, and then I would have a new ABD. So I'm just gonna reuse the one we have here, but I would have my new ABD and put that over, and then tape across, tape that down, and then I would put my initials, the date, and the time on the bandage. And then from there I would take my gloves off, and then I would sanitize, clean up my supplies, and then position the patient for comfort.